You're listening to the Birth Matters Podcast, episode 114. Hey there, and welcome to the Birth Matters Show. I'm your host, Lisa Graves Taylor, founder of Birth Matters NYC and director of East River Doula Collective. I'm a childbirth educator, birth doula, and lactation counselor, and I've been passionately supporting growing families since 2009. This show is here to lessen your overwhelm on the journey into parenthood by equipping and encouraging you with current, best evidence info and soulful interviews with parents and birth pros. Please keep in mind the information on this show is not intended as medical advice or to diagnose or treat any medical conditions. Did you know you can sign up to receive email updates whenever a new episode goes live? Visit birthmattersshow.com to join our podcast community. For today's episode, I'm excited to start something new. We're going to be hosting some perinatal professionals here and there interspersed with birth stories, and today we're getting started with that by interviewing a wonderful local Brooklyn-based craniosacral therapist named Regina Patane. Especially because in the past 2 episodes, both of the moms who told their birth stories shared how they sought out craniosacral therapy. I thought, a lot of people I work with haven't ever heard of that. So let's have somebody on the show to talk about it. So let's go ahead and jump in and hear from Regina. Welcome, Regina.
Hi, thank you for having me, Lisa.
I'm so excited to chat and spread the good word about the great work that you do. So Regina came onto my radar, a few months ago, and the doulas in my collective have gone to her, meet with her, and have a session with her, one or more. And then recently I sent my daughter to have a couple sessions with her. And I don't know what kind of voodoo you do, but it is amazing voodoo. We just had a check-in. Our doula collective has a check-in on Zoom to build community and support each other every week. And right before we met here today, in the hour before, we had our check-in and craniosacral therapy came up and you came up. And one of the doulas was talking about the magic that you do and just how phenomenal it is. So thank you for the work that you do. Would you mind just doing a little bit of a more formal introduction of yourself and how you came to this work and whatever you'd like to share to introduce yourself?
Sure, absolutely. So I came into the health and wellness industry in my early 20s, really because I wanted to fix my own health problems. I suffered from anxiety, depression, hormonal issues the medicals could not diagnose for years. And at one point, they suggested that it was all in my head. I had sleep issues, weight gains, I was losing my hair. The list just went on and on. And all they were offering me just basically masking the symptoms with pills, which I did not like the idea of it. So I decided to get into the field to learn about the human health and the human body and try to apply the knowledge onto me to then fix my issues. And slowly and surely I did. Started to unravel everything. I took several courses and applied, obviously, everything I learned. And my symptoms started to reduce greatly. Of course, I fell in love with the whole idea of, oh my gosh, there must be other people out there who also suffer all these issues and the medicals are not able to help them. So why don't I just stick to it and dive deeper into the whole industry? And as I said, my anxiety and depression, hormonal issues, all of those started to really subside. But there were still periods where they were all coming up, and I couldn't really figure out what was the link, why they were still coming up. And it was like every few months, almost like an anniversary kind of thing. They were all back for several weeks. And one day, a very good friend of mine who was also in the industry for years at that point said to me, you have got to go and have a session with this lady. Whatever she does is just absolutely amazing. And this was in London. So I take a session with this lady, and I crystal clearly remember lying on her couch and going, I don't know what the fuck this is that she's doing, but I have got to learn this. This is just like unbelievably magical. So we finished the session. She had a little bit of time and I'm like, okay, you have got to explain to me, what is this? Because I just went blindly. I don't know why am I here, but I was told that I need to come and have a session with you. So it was craniosacral therapy. And I'm like, okay, so I'm writing it down. I never heard about it before. And I went home and I researched it. And a few months later, there was a course that was starting in London. And I'm like, I'm signing myself up on it. So that's how my whole journey started. It was a 2-year-long course and it completely single-handedly changed my life. And all my symptoms, suddenly the flares up and everything made sense because I was able to trace it back to my birth trauma, as well as lots of other early infant traumas that my nervous system was still circulating. And every few months, it just relived it and gave me all those symptoms. So that was, to me, the turning point, really, where I fell in love with the work and I never looked back. And that's 7 years ago now since I finished that course. So that was about 9 years ago now when I first had my first session.
Amazing. And so you live in Brooklyn. And how long ago did you move to the States?
So I got stuck here at the very beginning of the pandemic. So for almost 5 years now.
Mm-hmm. Well, very glad you're here. So, can you explain to us first the basics of, for people who've never heard of craniosacral therapy? Because I get this question quite frequently whenever I bring it up in class. They're like, what the heck is that? I've never heard of it. Can you tell us a little bit about that?
Sure, absolutely. It fascinates me that in the UK, all the midwives, when they go through the whatever many years of schooling to become midwives, they now all know the benefits of craniosacral therapy, predominantly for the infants. So every one of them who gets qualified and then becomes a practicing midwife, they all tell their clients once the baby's out that please go and find a craniosacral therapist and have a few sessions for your baby because it's just pure magic. So I find it really amazing that over here it's still not mainstreamed at all. But what craniosacral therapy is, it basically works with the nervous system first and foremost, and the therapist creates a field where the client's nervous system basically is able to drop into the place where all the self-healing happens. So that's kind of in a nutshell, if I really wanted to simplify it. What it also does, particularly for infants, it's able to dissipate birth trauma that the baby's system is holding on to, and any kind of compression the baby's head, neck, back, or even pelvis suffers as a result of being born. And it obviously has a huge health implication later on if those compressions and tightnesses are not being dealt with as a baby. It will cause health problems later on in life. Like in my cases, the list can be pretty much endless, but depending on obviously where the compression is, what kind of nerves that area is influencing, those are the kind of, that's how the symptoms will basically come up based on where the compression is.
And can you explain a little bit more about the name craniosacral and like the physicality of that?
Yes. So it originally emerged out of osteopathy, which I think that's why it's got the very mouthful terminology, which nobody really likes in the industry, funny enough, but I don't think it will be changed anytime soon. So cranial means it's your head, and sacrum means the triangle-shaped bone at the back of your pelvis. And the reason we all think that the term comes is because your head is obviously hosting your brain, and then your sacrum is where your spinal cord finishes, or I should say the majority of the nerves are finishing. Of course, nerves are innervating our entire body, but that's what the name basically means.
I was just watching a podcast on a plane ride a few days ago, with a neuroscientist talking about how there are nerves in our heart, there are nerves in our gut, in our stomach. And I was just like, I've never even thought about that before. And it makes so much sense. Fascinating.
Absolutely. It's becoming again a mainstream terminology that we have two brains. We have one in our head and then one in our gut.
Mm-hmm.
There are way more neurons, nerve connections in our gut than in our brain. Really and truly, the gut brain is our main brain. But again, it gets shut off for most people because there's obviously issues that were never dealt with once we were born, coupled with the unideal diet that most people are having lately.
Right. Like in research that has been coming out that like in the placentas, there are all these microplastics. Like babies are born with this toxic burden on their bodies. Yeah. So the type of CST you do is specifically biodynamic. Can you explain what the difference is between that and, I guess, non-biodynamic?
Sure. So there are two types of craniosacral therapy. The one that is just called craniosacral therapy and then biodynamic craniosacral therapy. The craniosacral therapy, the simple one, is the very first spin-off of osteopathy. It was Dr. Upledger who brought it out from underneath osteopathy. It's very mechanical. They are taught on 10 steps, and anyone with any kind of symptoms, issues they would like to work on will go and see a craniosacral therapist. The craniosacral therapist will go through those 10 steps. So they are taught to look for specific compressions, specific alignment issues within that 10 steps. And wherever they find one, they just go ahead and undo it like an osteo with, you've got some compression here, and then they alleviate it with some manipulations. It was around the 50s when there was another two American gentlemen who then took it upon themselves and further expanded craniosacral therapy and created biodynamic craniosacral therapy, which is you go in with absolutely no agenda. You are not looking for any compressions, any stuckness in the body. There isn't a 10-step protocol. You're working with whatever the client's body is presenting in that moment in time. And you are following the body's lead because it's based on the very fact that every single body knows how to self-heal if the environment is provided for it. So as a biodynamic craniosacral therapist, we are first and foremost creating that environment for the client's nervous system to realize that this is my opportunity, that I can fix things within me whilst this person is holding this magical field for me. Feeling, obviously, where the compression is, but I am not looking for it. I'm only noticing it once the body is showing the patterns to me. And even at that point, we are taught to wait for the body's invite, and the body will give us the treatment plan. As in, at the beginning of the session, the body could show me 3-4 different areas. I don't know where the treatment needs starting. The body knows it. So I wait until the body out of the 3-4 areas shows me that, okay, we're going to start at the hip today. And in another person, it could be completely a different area where the treatment starts.
So am I right in interpreting what you were sharing about those differences in saying, generally speaking, that biodynamic is more energetically focused, whereas the other branch of CST or original is more physical?
Yes. Yeah, that's a very good way of looking at it.
Mm-hmm.
Yes,
and it also reminds me of, I think I shared with you in the past, my chiropractor does something called network chiropractic, but a more known term would be gentle chiropractic. And I think that's a very similar difference in, like, when most people think about chiropractors, they think about cracking things and popping things. And my chiropractor doesn't generally do that unless it's absolutely necessary. He really takes a more energetic approach, a much gentler approach, which for many of us who are in a state of fight or flight all the time, he explained to me, I don't want to be so aggressive with you because that's going to put you in more of a state of fight or flight. We want you to get to be more zen and regulated. And so this gentle approach is so much more effective in that way. And so that's how this resonates with me, this biodynamic CST. And another aspect that you had shared with me previously was asking for consent, the body's consent. And
Absolutely.
I love that. I love that so much because so many people are walking around with trauma and having experienced different kinds of abuse. And that's trauma-informed care to pause and to ask for a body's permission
Absolutely.
to touch them or work on them, and including babies. Do you want to say anything on that whole thing?
Yes. So I personally wait and ask the baby the same way as I would ask an adult's body if it is okay to put my hands on them and have a little listen and wait until the nervous system settles to show me where they need some help with. Yes. Every single baby obviously is like, yes, please. So they always give you the yes, but I always ask. I never assume that just because the parents brought them in and just because they were born a few weeks ago, and I know that there is always stuff, I don't assume that, oh, sure, the baby just needs treatment. I always ask.
I suspect that some listeners might be hearing this and being like, that's really woo woo. Like, what do you mean by asking a baby for consent? Are there any like physical cues? I'm sure some of it's energetic, but is there anything you would add for those skeptics out there who might be like, that's not a thing? They can't tell you, yes, I consent.
Sure. I actually asked the baby out loud in front of the parents. So at the beginning of my session, certainly at the first session, I do tell the parents, I talk to the babies out loud because believe me, they do understand you. They obviously don't understand every single word like you and I do, but they do understand what you are saying to them and they will respond to you. So I asked them out loud, or even before the question comes, I'm already looking at them to see what kind of signs they are showing me. And so basically at the very first session, I take a case history. I ask the parents about how was the conception, how was the whole pregnancy, and then of course the birth. And the baby will always tell you where they had issues. So to me, it's just absolutely mind-blowing the amount of times the mother gets to a tricky period of recalling, let's say it's the birth or it's just the whole labor and the examination, and the baby will start crying. And that cry has a very different quality. If you really listen to it, you can hear it's full of feelings and it's full of emotions. There's really some upset. There's real anger that the baby is displaying with their cry. And sometimes the mother is actually talking about, oh, yes, and over here, everything was absolutely fine. And we just waited and we had a great time and we were supported. And the baby starts crying. And it's not that what the mother is saying is not true. The baby experienced it differently. So that's another way of just taking notes before I start the actual hands-on treatment with the baby, that I watch and listen to see where the baby is telling me that they actually had some issues, whether it was during pregnancy, conception, or just being born. And then I do ask them. Another way that they will display asking for help is, and it's particularly true for the head area, they suddenly start rubbing their eyes, scratching the face, or even pulling on their ear, just to show you that this is the actual area where I do have compression and please help me. Mm-hmm. And when they do that, they always look at me. They look so incredibly deeply into my eyes that it always gives me a chill.
I just got a chill.
Yes, and me too right now, because it's that you're watching me, you understand what I'm telling you, right? And I know you can help me. I'm telling you, it's an incredibly privileged and such a magical moment when the baby looks at you with that, you can hear me. I know you understand what I'm saying. So I'm going to show you everything.
And how therapeutic for the parent that's there too, to witness that.
So then
Right?
I go ahead and I explain the parents, can you see this is what they're doing? It means this. And can you listen to that cry? Can you hear all that anger in that cry? There's another way. Actually, the very last baby I just treated last week was showing me on his first session. There's a point where conception and the discovery that the mother is pregnant comes up. And if the baby wasn't planned, then again, it's almost like the first possibility for a baby to experience trauma of not being wanted or even considered for an abortion, even if it was just a short period of time, and they will show you. So we have gone through, the baby showed me some scratching of the face, rubbing of the eye, and he was not sleepy at all. And they confirmed that he does this periodically. And I don't know what it means. So we dealt with that. We helped, I think it was the right side of the head that he was scratching and rubbing the eye. So we helped with the compression there, and he calmed down and he was just chilling on the mom's lap for a good 10 minutes. And we were just talking about all kinds of things. And then suddenly he looked straight into my eyes again, and his lips started to shake. And I'm like, okay, here it is. He's going to show me something else. And he just threw his arms out like a stretched out arm position. And that immediately signals to me that this is a discovery trauma the baby is showing me. And he started to cry. Again, the cry was a very particular type of cry. And he kept staring into my eyes. And within about, I would say, 45 seconds into a minute into that very typical quality cry, he displayed a tremendous amount of anger. And I looked at the father at that moment because there was just a very particular facial expression on the father's face. And the mum looked a little bit withdrawn. And I was almost wondering if she finds this a little bit too overwhelming. And I looked at the father and I looked at the mum and I just asked, was he actually planned? And at that point, the mother started to get a little bit upset. And she was like, no, not really. And the father looks very sheepish at that point. And it turns out that she really wanted to have a baby for a very, very long time. And he wasn't. And then he adds, and he's like, look, I knew that we were in that period that she was fertile. So I guess I knew what I was doing by not using protection, but we never really agreed on, okay, let's try for a baby. She got pregnant immediately. So the following month, she tells him that, hey, we are pregnant. And using his own words. So I said to him, how did you take it? Considering that for years you were against having a baby. And he said, I just didn't know what to do with the information. So for 3 days, we weren't talking to each other at all. And I didn't react at all, other than just going completely mute. I said to him, this is exactly what the baby is showing me right now. How angry he was that he felt unwanted for 3 days, at least on your side. And at that point, the mother got very emotional, started to tear up. And I said to him, this is the perfect opportunity to just wipe that slate nice and clean, just witnessing and take responsibility that that baby didn't take it very well, so rightly, that you didn't want him here for 3 days. So we did a little repair in that moment, and the baby stopped crying. And again, so there are ways that the baby will show you during the sessions what particular area he needs help with. And they do tell you the story if you know how to listen to that story.
That's amazing. And the perception and intuition you have in your work is off the charts. Like the Dualism at Collective who've seen you, and my daughter was looking over at me when, as you know, after the session, when you were just giving her the things that you observed, she was looking over at me like, how does she know that? How does she know that? Like, it was wild. It really just so cool that you have this expertise and this intuition and insight. And can glean that. And in my session, I was just lying on a table and you were holding my feet and then coming up to my head, and it seemed like you were hardly doing anything. And yet you clearly were doing a lot. Really powerful.
Yes, I don't know why it happens to me. I know that it doesn't happen to every craniosacral therapist. I've got many colleagues who don't have these kind of experiences during sessions. For years, I was always fine with it. So I stopped questioning and I stopped wanting to understand why these things come up. I think it's a combination, if I really had to guess, I think it's a combination of just being okay with whatever comes up, having enough compassion to just witness whatever comes up without any judging, any kind of intellectualizing. And then really the most important part of it is clearing your own shit. I don't know how many hundreds, certainly in the thousands of sessions myself I've already had. So the clearer the therapist is, the more they can be present. And whatever you clear out of you, the client's body will know that, this is something I can bring to you because you either had a similar experience or you have the compassion, the capacity to hold it. So again, this is where the body's own intuition does really come up, and able to figure out just how much I can give to this therapist. Can they hold my stuff really and truly? And if they detect that they can't, they're really not going to show an awful lot. You're just going to have a relaxing session and that's about it. But not an awful lot will get released. That's for sure.
Can we take a little deeper dive into, you mentioned, I think more than once, the term compression for babies. Can you explain a little bit about what you meant by that?
Sure. I'm going to start with vaginal birth. So if the baby comes through the normal way, then if you imagine when labor starts and the cervix is getting ready to open up, and of course it can take however long, the baby's head is engaging, right? That's how the whole process starts. So a lot of the times parents will see this baby I just mentioned earlier on. The father said, oh my gosh, yes, when he popped out, I was freaked out because he had like a cone head. So the first compression they will experience during birth is the top of the head. It's when they engage and they're waiting for the cervix to dilate enough for them to start coming down. So the top of the head will almost always have compression. And the reason it happens basically is because you have to imagine that the baby's head is basically like a jelly, in order to make it much, much smaller once it starts descending, which is the reason why we're born prematured, because our head just doesn't have space inside the mother's body to fully develop before we're actually really, truly ready to be born. This jelly head basically doesn't take an awful lot before it starts picking up compression. So
I love jelly head.
Because everyone always understands when I use the jelly head terminology. They're like, oh, yeah, okay, I understand what you mean. And if you've ever seen a skull model, you might have noticed those zigzag lines. They're called the suture lines. They are separating one cranial bone from the other. Now, every single cranial bone will be in several pieces on a newborn, for the very reason because the head needs to get much, much smaller in order to come through the birth canal. So, as I mentioned, the top of the head will have compression first and foremost. Then once the baby starts sliding into the inside of the pelvis, their head is going to have to rotate to one side. Doesn't really matter that they always rotate to the right or the left, but they will rotate to one side. And whichever side is meeting that triangle bone at the back of the pelvis, if you imagine that bone, I'm trying to explain it without having a visual. So it's pointing forward, and the side of the head is going to be against this triangle-shaped, super bony, really not much meat on it whatsoever for padding. Now imagine that jelly head is meeting that triangle bony structure. And then it's going to have to rotate again and come under the pubic symphysis, which is the front of the pelvis, to then eventually come out of it. So the side that is meeting the sacrum, the triangle-shaped bone, is really the side that gets most of the compression. And sometimes you see it that this side had enough dragging force to leave visual cues like this side, the eye might be a little bit closer to the nose or a little bit lower because there was so much dragging that happened as the baby was turning and rotating inside the pelvis. So that is an insane amount of compression. And that's why the baby starts rubbing the eye, scratching that side of the face or pulling that ear, because they're trying to help themselves by trying to decompress that area. And the other thing to mention is this sometimes, in my view, the reason why babies starts asking for very frequent cluster feeding, because whilst they're breastfeeding, they are able to decompress all this area just by sucking. I don't know how long that decompression that they're able to do with sucking on the breast will last, but even if it lasts another 15, 20 minutes, they feel much, much better for that interim time. And then the compression comes back, the tightness returns, the pain, the discomfort returns, and then they start crying again. The rubbing happens again, and the mother either feeds again or they don't.
That's fascinating. I hadn't heard that idea about the cluster feeding. Thanks for sharing that. So then compression, what's the difference with a belly birth, with a C-section?
So different in a sense that obviously the baby is not going through the birth canal. The head, actually, sometimes the head still get compressed because they might get stuck halfway through, right?
In the pushing stage,
They can still have compressions. Almost always the top of the head, unless it's a planned C-section, will also have the compression because they were ready to come out the correct way, so to speak. But more importantly, there is a huge difference between a C-section baby and a natural birth baby. And it is a term that we use in the cranial world called the C-section babies will have a cannon head quality. So the head will feel very tight and quite heavy, hence the cannon head terminology. And the reason being is that inside the mom's belly, there is a certain amount of pressure. Any room in the world outside will have a very different pressure, and the change is quite significant. So when the baby is born in a normal way, the pressure keeps changing via the birth canal gradually. So the baby's head doesn't experience a very quick pressure change if they come out the normal way. But with a C-section birth, they whip that very, very quickly. And therefore, the pressure change happens very suddenly. And now this jelly head just basically locks down because of the sudden pressure change. So that basically means that the head now has an overall compression pretty much everywhere. And in some cases, the head will have even more because they were turned in, they were trying to come out the other way. Or if they descended halfway down the pelvis, that one side of the head might already got enough compression anyway. Does that answer the question?
Yeah, it's fascinating. Another thought that came to me that came up in our collective chat this morning is in the UK, my understanding is that gentle cesarean techniques are more common than they are here. And that in a gentle cesarean, one of the gentle cesarean techniques to try to replicate a vaginal birth as much as we can in a surgical birth, that the baby is lifted out of that surgical incision much more slowly, as much as allows, so that they're trying to replicate the squeezing and that kind of effect. And I had a recent respected OB here in the city who taught a workshop for perinatal professionals on gentle cesarean techniques. And I'm hoping to have them on the podcast as well, talking about those approaches. He talked about how he slowly lifts the baby out to be born, and how when he reaches in with his arm to retrieve the placenta, how the uterus is so powerful, and that it feels like a snake is really tightly wrapped around his arm. And that was to demonstrate how powerfully a baby can be squeezed, similar to, not the same, but similar to the vaginal squeezing in a physiologic birth. I just thought that was a really interesting description that I hadn't thought of before, and was just thinking about how it relates to this idea of compression that you were talking about. But it also interesting, a sort of related but different thing that you just described about the sudden pressure difference in the environments, not just the movement of the squeezing as a baby's being born. That's so fascinating.
There are also certain reflexes that get ignited if the baby does come down the natural way, just because they have to turn the head and then the body goes with it, which again, C-section babies do miss.
Mm-hmm.
And also another thing in terms of the difference between the two different way of being born, when the baby comes through the vaginal birth way, the body basically starts accumulating quite a lot of energy, particularly for the final kick and push and arch as they come out. Now, all that energy gets stuck and never gets used in a C-section birth because the baby gets pulled out. They never had to kick, they never had to turn, they never had to do the arch. So I see it again and again that the baby's arching, trying to so very cleverly, but unfortunately unsuccessfully, trying to finish what they never had a chance to do. And also you always feel this really potent, stuck, buzzing energy in their body that is just there waiting to be used. And that's usually one of the first things that they release once I put my hands on them. And that's when the parents pick up the baby after the treatment and they will tell me like, oh my gosh, they feel like a rag doll. Suddenly they don't feel that tight and heavy. And it's all that stuck energy that is out of them suddenly. And that the entire nervous system just has finally an opportunity to relax, which will obviously help the whole sleeping, the feeding, the pooping, and just the overall demeanor of the baby changes absolutely immediately. I've got another fantastic teacher who done a very tiny little study of his own with a teacher and her own classroom. Every single parents agreed for this little experiment. And he basically wanted to see whether there was really a developmental difference between vaginal and C-section kiddies. So they were around 3-4 years old when he conducted this little research. And he asked the teacher to just observe the children and make a list if she noticed any significant difference between kids, predominantly like kids who were having a hard time playing all by themselves, starting or finishing a puzzle, not necessarily antisocial behavior, but social interaction was a little bit lacking. So she compiled the list, and then he did his own little experiment and play and what have you. And he made his own list and he compared it with her list, and it was completely identical. So he conducted that every single C-section babies in that class, which granted was a small class, had the same characteristic of just not knowing how to stop and start like a puzzle, how to finish things. And he believes, as well as a little bit of a social interaction lacking. And he thought that it was down to the fact that because they didn't choose to be born a natural way, whether they were planned C-sections or the baby just wasn't ready to come out. So their very first experience was that something was done to me without my consent. Therefore, it becomes the brain's first imprint that in the craniosacral world, we know that's how it is. The birth will become our nervous system very first imprint, and everything will be just compared to that afterwards. So even he, who is not a craniosacral therapist, saw it, that there is definitely a correlation, that the C-section babies are a little bit lost and not knowing what to do because they didn't initiate their own birth, which I thought was fascinating.
Yeah. And I would add that I'm sure this is where you were headed with this, but that thanks to this, as far as I understand it, newer understanding of neuroplasticity and the work that you do, like those neural pathways can be adjusted and retrained for the better.
Yeah.
Because I never want parents to be hearing, crap, my baby was born via C-section and now all is lost. Absolutely not. Absolutely not.
No, I completely agree. And that's certainly that I keep re-emphasizing during the sessions that, just because it happened, it doesn't mean that the baby's doomed for the rest of their life. The very fact that they are here and they having these sessions is what's going to help them just erase that first memory. And then they're going to have a very different future ahead.
And the movements that you were referring to that babies in a physiologic birth will do, I don't know if they call it cardinal movements in the UK. Here we call it cardinal movements. I'll include in the resources in the show notes for this episode some visuals on that. If I can pull up, there's a video that's really beautiful that shows those cardinal movements. Or at least I'll include a description or maybe both. But just for people who are like, what does that mean? What do you mean when you say these movements that they're meant to do? So you've already touched quite a bit on the different benefits of CST for babies. Can you talk a little bit about, or is there anything else you would want to add on that? And then once you're done on that, then going into the benefits for a parent.
Anything else for babies? Certainly also helps with the bonding, particularly again, highlighting that in most cases, when it ends up being a C-section birth, certainly if it's an emergency C-section, then the bonding kind of gets interrupted by, obviously, the main focus is like there is an imminent danger that needs treatment, completely understandably. But ideally, when the baby is out, they do need to be put on the mom, skin to skin, and really and truly, you just want to let them be. Ideally for the first hour for sure, because it is a lot that has just changed for that little thing, let alone for the mom, for the parents. So again, that's something that quite often they don't get to experience. And I've worked on so many adults where I see them during a cranial session, the entire birth process, how they were coming out, where they were stuck. It's like a movie that the body shows it to me. And again, coupled with how angry they were that I got taken away, or how frightened they felt that suddenly I was in this room, this stranger was handling me and wiping me and doing all these procedures, shoving a tube down my mouth. And I don't know where mommy is. You can only imagine how incredibly frightening and stressful that is going to feel to a baby who just made a huge adjustment of coming out and going through the whole birthing process.
And whose baby, I'll just add that, and whose brain, the baby's brain doesn't understand object permanence yet. So when they can't see the parent, they think they're gone forever. So it can be particularly upsetting for them.
Yes, it always makes me quite emotional when the adult body shows me, because it's really so incredibly strong what they did experience, and you can't help but to have so much compassion to what they had to experience. And unfortunately, some of it are completely unnecessary. If we had a better understanding, then a lot of these things could really be avoided. Do you really need to wipe the baby and clean it immediately? It's just crazy. Do you really need to weigh the baby immediately? Come on. And then another thing to mention is the early cord clamping that will give what we call, again, in a cranial world, umbilical shock syndrome. A lot of the time, it will feed into digestive problems for the baby. If you cut the cord too soon, then that whole belly button area is just holding that sudden shock that I got disconnected from mom. And I have no idea whether I'm coming or going. Where am I in space? Ideally, which I know, unless you are so fortunate, you want to wait until that cord is basically, there's no blood in it whatsoever. It's white.
Wait until white. There's a whole campaign. Wait until white.
And it stopped pulsing. Now, it can take any time, anything from 20 minutes to up to 40 minutes. And again, in hospital settings, that will never, ever happen. In the UK, we've gotten years and years ago, again, the midwife started campaigning against it, that they automatically wait 2 minutes. Last time I checked, it was still 2 minutes. It's way
up to
better
3 here with OBs. And then some midwives in hospitals will wait up to 10 or so. Home births and birthing centers, they do wait until it stops pulsating.
That's exactly your absolute most ideal place where you're really allowed to have that time, whether it's 20 minutes or 40 minutes, right? So that's another thing that the baby can display. And we didn't touch on it, but IVF babies are a completely different kettle of fish, and entirely because of obviously how they were made, right? All that procedure, all that drug, all that poking and checking and everything is very much in the person's nervous system. So I can always feel it. It's got a very different quality to it. And they almost always have, I'm lost in space, I don't know where I am quality about them.
So this is still babies you're talking about, not the parent?
No, you can feel it in a parent. You can feel it in an adult as well. Last time I worked on an IVF person they were in their teenage years, and I could still feel that quality in them. And I had a long discussion with one of my mentor, and we came to the conclusion that it's possibly because they weren't fertilized inside the moms. They out in the wild, they have wild, you know what I mean? They have no way of orienting to something. And that could be the basis of just feeling lost and not knowing where they are. And they also display a very strange buzzing, kind of spinning quality, which we think is the downside of all the drugs that were given to the mom to get the eggs out, etc., etc. So yes, that's, again, I can only imagine how you must feel if all of that is in your nervous system 24/7. You know, how are you going to be able to just enjoy life, just to start with, if you feel like you don't know whether you're coming or going, you've got a buzz and a kind of a spinning sort of quality in your system? It's really not great at all. One other thing to mention is, looking back now, I have an almost 2 decades of nanny experience when I lived in the UK. And the very, very first baby I looked after when I was only 19, and obviously I knew nothing about any of these things, but he had a horrific birth. He was born dead. The cord was wrapped around his neck. He was black, blue, and everything. And they were resuscitating him for a very long time, to the degree that they were about to put him to the side and declare him dead when he came back. And that kitty screamed the entire house down every night. I have never heard a baby scream that quality. It was like someone was torturing that baby. It was unbelievably upsetting. And the mom didn't care about it. She offered me a pair of earplugs if it bothered me. She just left him screaming his cot. And I couldn't do it. Something inside me was like, I don't know how you can do this, but I cannot do it. So I used to have him just basically, I'd pick him up, and eventually he'd quiet down and he'd fall asleep on me. And I would try to put him back into his cot, and he'd be up again and screaming. So I spent 3 nights leaning against his cot, him sleeping on me, and I'm sleeping practically nothing at all. And I said to her, look, I can't function. Now I'm completely sleep deprived. I haven't slept for 3 nights. And she said, I told you I can give you a pair of earplugs. So I didn't like that option at all. And of course, I didn't know what else I could do other than I just knew that the baby needed human contact and I could offer that to him.
Mm-hmm.
So we came to an agreement that she agreed for me to take him into my own bedroom. I had a single bed wedged against the wall, and that's where I put him. And he would be sleeping on me. So I co-slept with him for months before he stopped the screaming. But although he came out of it, he obviously never got professional help for it, as in, had I known that he needed craniosacral therapy, I would have certainly suggested it to the mom. Whether she would have taken it, that's a different thing. But I noticed him when he turned around, coming up to 2, that he was having severe behavioral issues. He was banging his head against the wall and all these kind of what we now would probably put on the ADHD and all these funky labels.
Neurodivergent, yeah.
Mm-hmm. That I remember when I went into the cranial world, I just went, oh my God, that baby. He was reliving his entire horrific birth every night, and he was born during the night. Mm. And although I must have helped him because he stopped doing it several months down the line, he still didn't get what he really truly needed. And I can only imagine how much compression he must have had, that it was then coming out later on, a year and a half down the line, as behavioral issues. And again, with a fantastic mentor of mine, we talked about it several times, and he certainly wholeheartedly believes that in most cases, these kids that are labeled with all these behavioral issues, they really just have all this stuck energy and compression, which then causes problems on the nervous system, that it comes out as behavioral issues. And there's nothing wrong with the kid other than they really just need treatment.
I'm glad that family had you to at least just hold the baby, give a little bit of that nervous system regulation. One thing that kind of came to mind, Regina, when you were talking about belly birth with C-section, was that a shared client, I just wanted to share with listeners, you already know this, but a shared client of ours who gave birth via C-section, I recommended you and they went to you and had a session. I can't remember if it was one or more sessions. Several of my clients have gone to you and have loved your care, but this one really stood out to me. She just was like, I was not feeling myself. And then I went to see Regina and I felt like myself again. Mm-hmm. And I just thought that is such a powerful testimonial, the power and benefits of the work that you do.
Yeah. So moving on to the second half of your question, what does it do to the parents, particularly to the mom? I really cannot say it enough times how incredibly beneficial it is for the mom, particularly after a C-section birth, for a number of reasons. It usually is an unideal scenario, and most of them did not want a C-section at all. So you already have all these kind of sorrow and heartache and guilt and all of these emotions, but there are layers and layers and layers of muscles that then now cut through. And almost every single C-section mom I've ever worked with, they all say that, oh, yes, it's healing nicely, apparently, or the 6 weeks check is all clear. Supposedly it's all healed. It's fine, but it's numb. I don't want to touch it. It's like it's not part of me. Or I crystal clearly have an upper and a lower part with a straight line where the C-section is, or it gives them pain. And I have a pain management background. I had a pain management practice on the side in the UK for years. And I got very passionate about working on scars because I have never seen an untreated any kind of surgical scar not giving problems sometime later down the line. And I could have made an entire practice just on treating any kind of scars, because I've had clients who like seen everyone and they're like, no one can figure out why I've got a shoulder pain, but I'm scheduled for a surgery. And I'm like, any type of scar, particularly if it's a woman, I'm like, did children? Yes. C-section? Yes, it's all fine. And I'm like, let me see that scar. If it's been untreated, I don't care whether it's 15 years old, 25 years old, or 45 years old, it will give you problems. And I start working on the scar and they always look at me like, what the hell are you doing to me? That shoulder, that knee, that lower back is now raging. It's like you found the pain switch and you just cranked it all the way up. And I'm like, this is why it needs working on. So there is, again, a long-term consequences of not having that C-section scar treated. I've seen it time and times again. So that's one. But on top of it, obviously, there was a baby inside you growing for 9 months. So can you imagine the amount of tissue change your entire tummy / inside of your pelvis had to go through to accommodate a fetus growing every single day for 9 months? It's huge. So when you have a C-section, when you have a craniosession, all those tissues just go, okay, great, I can come back. I got pulled this way, stretched that way, and suddenly they can just all come back to where they were before. So, of course, you're going to feel way better getting off that couch and you go, okay, so I don't feel the separation. I don't have the numbness and I just feel more in my body. How could it not be beneficial?
Absolutely. Yeah, that scar tissue mobilization is so important. And we just neglect women in our culture in the US anyway. And I just feel like in birthing bodies, whether we identify as women or not, do all craniosacral therapists work on that aspect, or is it just because of your pain management background?
No, it's because, again,
that's what I thought. Okay. Yeah. So just to clarify, I love that you can work with Regina, and then also pelvic PTs or OTs would also work with people post C-section on scar tissue massage mobilization so that the fascia doesn't fuse and get stuck. Mm-hmm. And yeah, we can work out some of that scar tissue in a really important way. I'm really glad you brought that up.
It shuts down every muscle that gets cut through that scar, all those extra layer of tissues that got laid down by your body in order to heal that cut is now shutting down the muscle. So again, if you are someone who was active before and then now you've got pain, I can only imagine how frustrating that must be. Or if you're someone who would like to regain their pre-pregnancy body shape and they can't because it doesn't matter how much they exercise their abdominal muscles, it's just doing nothing. It's doing nothing because if it's got cut through, your brain basically has no way of communicating to that muscle. Mm-hmm. You can exercise it until the cows come home. Nothing will change because of that scar tissue. We covered the natural birth and the C-section birth. It's important to mention that even with natural birth, there are different categories. So the baby can be born very fast, like it was my case. I popped out within half an hour, start to finish. No wonder I had so much cranial compression. It's a lot. Mm-hmm. Now, again, if the baby is born over a longer period of time, so long labor will have another set of different kind of compression because the baby was inside stuck for so long. Vacuum forceps again will have a completely different imprint that they leave on the baby's body. Mm-hmm. So again, you have to treat with what the baby is coming in with, but they all have a very particular quality to it. So the body always tells you the story that they went through. I had a client in the UK who came to me with a shoulder problem, not a C-section scar. It was an abdominal scar, but it wasn't a C-section scar. I can't remember what she had. Doesn't matter. I helped her with the shoulder by working on the scar. And she had 3 children at that point. Her youngest one was about 2 years old. And we're just talking during the session. And she tells me that she still doesn't sleep through the night. She screams in the middle of the night and everyone is like beyond exhausted that 2 years and she's still not sleeping. And otherwise, she's very happy, she's cheerful, but she was born very fast. She basically came out in the car park of the hospital. So by the time they drove to the hospital, she was like half her head was out. And her feet were turned completely inwards. So her toes were just basically staring towards each other. And she was obviously freaked out seeing her third baby coming out like that. And she was just assured that, oh, this is not too uncommon. Don't worry about it. The legs will just fix itself. And she's like, now that she's walking, she constantly trips over her little feet and falls over 5, 6, 7 times a day. And of course, it's frustrating. And she gets the little bruises and scrapes here and there. And she's like, we don't know what to do with her. We took her back to her pelvis to be examined. And they said, there's nothing wrong. Everything is just absolutely fine. So she'll grow out of it. So the moment I heard that she was a super fast birth, I told her that this could be it. And she's like, right, I'm bringing her. So she brings her in, never met the little girl, super chatty, very friendly. I'll chit chat with her for a bit. Then we agreed that she's happy to sit on my couch, and we're talking to her. And the mother told her that we're going to go and see Regina, and she's going to have a look at your little feet and try to help you so you don't fall over. So she was all completely on board. So I remember holding her feet, and almost immediately I'm feeling that buzz, almost a similar kind of buzz like the C-section baby's body hold, because they couldn't do the push. And I thought, oh, I wonder if, because she came out so fast, she couldn't do the push. She was just like basically head down sliding. And anyway, it started to get stronger and stronger. And chit-chatting to the mom, she's having a good time. And I'm thinking, wow, this feels incredibly painful at this point. And I was about to check in with the little girl. She's lying down on my couch, legs are dangling. And she sat up, she looked at me and she's like, that's it, I'm going home now. And the mother is mortified and she's like, darling, we don't talk like that. This is very rude. And I just signaled to the mom, no, that it's all fine. I'll tell you later. So I said to her, that's absolutely fine, no problem. And I had a little swing chair in the room that she was very interested in. The first thing she walked in, so I offered her the chair. She took it. So I'm talking to the mom and I said, it was pretty intense. So I can only imagine that at 2 years old, you have no idea what you're feeling. And it spooked her a little bit. So the very next day she emailed me and the subject line was, you're never going to believe what, ... And I opened the email and it said, she has slept through the entire night.
Amazing.
Never had an issue afterwards with sleeping. She brought her back 2 more times, I think, for the legs because they started to straighten out the feet.
Mm-hmm.
Never had a problem with falling over, none of those things. Yeah.
So powerful.
So it's like, you can call it however woo-wee and whatever you want to call it, because I completely understand it's very difficult to kind of understand what's going on there, especially that you don't really see anything really happening. But when you see and hear these results, to me, it's like, I'm sorry, but you cannot argue with it. That something changed in that system. Mm-hmm. And they are now not reacting the same way as they were before.
Mm-hmm. And it's one of several things that I really, really, really wish here in the US was standard of care, was more readily known and that it was just standard. I wish that CST, pelvic PT or OT, and breastfeeding support for those who want it.
Yes.
That should be standard of care. I really wish it was.
Yes, you touched on it earlier on that how much care a mom is getting after birth is like absolutely zero. And it's really heartbreaking, like way, way, way back, an entire village was supporting the mom with the newborn. And the food was there, every help was there, the help with the baby, the help with the household. And yes, it's not happening anymore. So of course, it's incredibly difficult to bring up children in this day and age. With no support, an insane amount of crazy expenses, just living expenses, let alone getting extra help with that baby.
When you're working with new parents, do you see connections being made, like their own birth stuff coming up when they've gone through birth.
Yes. Your own birth story as a mother will always going to come up and get reactivated the moment you enter birth.
And sometimes for partners too, right?
Oh, absolutely.
Yeah.
The amount of times, which is why I'm always keen on seeing the entire family, because when you're having that initial chit chat with them at the beginning, you get a good gauge on is the mother getting enough support by a partner? Is the partner getting enough support by anyone, really? How are they doing? And it's been at least a handful of times I can think off the top of my head where the partner was highly traumatized. The mom was okay, even though they really went through some horrific stuff. But the partner was completely and utterly traumatized. And you could see that they had this very vacant facial expression. And I had two men, they didn't even want to hold their babies because at one point during the birth, they were obviously in, and what they saw, and then the complications that happened, and almost losing the partner freaked them out completely. So again, it's heartbreaking that you can get help for it. So you can be there and enjoy your new family and bond with your baby if you just know how to get that help. But yes, your own birth story will definitely come up, certainly for the mom. And I would say certain aspects of your, maybe not necessarily your own birth story, but how you were cared for as an infant will come up for the partner 100% sure. Just to give you a very quick example, I had a young family here a few days ago, and the partner looked just a little bit closed off. And I asked him if he knew anything about his own birth story, and he was a C-section baby. And there were complications. So he was in intensive care for almost 2 weeks. The mom was expressing and just sending in the milk. So he was not with the mom for the first 2 weeks straight after he was born, because it was back in the days kind of thing that they were like, no, I believe the mom had some medical complications. So she needed to be in one ward. The baby was in another ward. So he looked very anxious when he was holding the baby. And every time the baby made that slightest noise, he was just not shaking, but trying to soothe the baby. And he was constantly shooing the baby. And the quality I was picking up, that his entire energy was just like, you have got to stop making noise because it makes me very uncomfortable. And again, it's very sad to see that it didn't need to be that way. So I had a chat with him about how much do you think your own experience is coming into it? And he thought about it, and he took his time to really think about it. And he's like, I guess I never thought about it that way. But I can see, and that's when he tells me all of these things. And I'm like, so can you see that what you experience is your own helplessness, and no one is there for you, and you end up projecting it onto the baby unknowingly, and what it does to your relationship with the baby. And he was very open to it. And it's like, okay, I'm coming and having my own session with you. That's it. Because I certainly do not want to pass it on to my kid, now that I understand what I could be potentially doing.
Yeah. So sometimes we project things, sometimes we overcorrect in things we're like, we want to do this differently from our parents. And then we like swing in the totally opposite direction, which also can not be great. Yeah.
Yes.
Mm.
Yeah. When I was a nanny, certainly the last few years before I stopped being a nanny, I constantly saw don't know if you use the same terminology here, the helicopter parenting. And I was like, I know exactly how your childhood went based on the fact
you felt abandoned. Yeah. No.
Yes.
We're going to be so involved.
That this overcorrecting. And then again, you having to educate them that you're really not doing any good for that kiddie to be right behind them all the time and bubble wrapping them, sort of thing. Yeah.
They need to fall down, learn to pick themselves up sometimes. Yeah.
Indeed. Yes.
I know you teach a workshop on the different types of babies' cries, and I'm so intrigued, and I really would love to take the workshop sometime. Anything you'd like to share about the different types of babies' cries? And yeah.
So yes, it is a workshop that is called Baby Talk Decoding the Cry. It is held in Greenpoint in a baby store called The Wild. Once a month, we'll see if it picks up, and it's viable to keep it that way. It's usually on a weekend. This month and next month, it will definitely be on a weekend, on a Sunday morning. And it will be a 90 minutes workshop. And I'll go through the whole, just unpacking what your baby is trying to tell you with the different type of cries, which there really are two. And we always seem to think that there's just one type of cry. So I cover what needs cry is, which is basically when your baby is hungry, when they're signaling you that they need a diaper change, they're feeling cold or too hot, or they need a nap kind of thing. And then when is it when they just bringing up something very different, what I call the memory cry. And that's basically they are reliving their birth, all the difficult aspect of their birth, and they're showing you where they need help. So how to identify that and what you can do about helping your baby resolving their memory cry issues, and what happens, more importantly, if you don't do anything about it. Because I see it working with not just babies, but adults. I can totally see how it will transpire into something much more significant later on in life if it gets missed.
A memory cry. That's fascinating. Thank you. Well, is there anything that you haven't gotten to share yet that you'd like to share, and any final takeaway that you'd like to leave expectant or new parents with?
Yes, I think one of the most common question I get asked is how many sessions my baby or both of us will need. And it's very difficult to give you a straight answer, particularly before the very first session. I always have a much better understanding after the first session. Generally speaking, I do say it's really not that many. In order to resolve the whole birth story, both for you and the baby, it doesn't take long, certainly not for the baby, because that's all they have. For adults, we have all 20, 30, 40 years of
layers of baggage.
Right? Exactly. We've got suitcases behind us, right? That are lagging. A baby, they just came with not even a hand luggage kind of thing. So generally speaking, I say that if you're looking at 3 to 5 sessions, in most cases, unless a lot of things went wrong and there's really layers and layers of stuff, but generally speaking, 3 to 5 tends to be enough. So it really doesn't take that long, that's for sure.
Yeah. And with my teenage daughter, I was surprised for her to come home after the second session. And she said, I'm done. I was like, what? Wow. Hardly ever does a practitioner say, no, you don't need to come anymore.
Yes, with adults, you can quite often just really get a feel that the body is like, right now, I'm good. Thank you very much. Mm-hmm. A couple of years ago, what was she, 18, going on to 19-year-old with very heavy suicidal, self-harming thoughts that she really was super desperate to get help with. She's seen some psychiatric help, and she didn't want to be on the medication that she got offered. And someone suggested to her to come and have sessions with me. And after the first one, I said to her, to me, it feels like within 5 sessions, we can make this really move it along. And she agreed. So I saw her for 5 consecutive weeks, once a week. And she came back after the second one. And this is where I certainly wish that I would take photos of people before and after, because I barely recognize her face. She looks way more younger and very vibrant. And suddenly she smiled, and there wasn't that super dark cloud over her. And she was like, oh my gosh, this week was already so much better. And after week 3, she's like, oh, I only had it twice. After week 4, she's like, you know what? I had it just once a week. And there's something in me keep growing. And that just makes me let you know that I will be fine. I'm coming over this thing. And again, in her first session, her horrific birth came up. She got stuck 3 times for an extended period of time. And she was just so full of rage. And at one point she wanted to give up and just, I can't do this at all. And then because she got stuck so many times, the cord was wrapped around her. So she got put into a different room for a good half an hour to 45 minutes. So again, there's just a lot of stuff that she was holding, with obviously a few bits and pieces on top of it that we all experience. It's just part of life's rich pattern. And for whatever reason, at that time that I met her, her body was just like, I'm done. I can't hold all of this in. And she was coming from a culture where we don't talk about feelings and emotions. We just stuff everything down. And she just reached her tipping point. But her body was very cooperative and just came up with more and more stuff every single session. And we stayed in touch for weeks afterwards, just like checking in, just to make sure that she's really fine after the 5th session. And she got married. She's happy. She took a job that she always wanted, and she didn't have the guts to do it. She took up driving, and just a very happy, completely different individual than the first time she walked in.
Amazing. I think that idea of taking photos is a great idea, although it might be awkward the very first time you're meeting with a client. I can see that being weird, but wouldn't that be so telling? And so even for them to just have that.
Yes. Yes.
And then if they want you to be able to share it as a visual testimonial, then you could.
Yeah, absolutely. Absolutely. You see it on baby's face as well, especially if there's enough compression that it halts the nervous system or dampens down the nervous system. Once it clears, their face look very different, like literally immediately after the session. And you're like, wow. And the parents notice it. It's like, wow, they look different. And I'm like, yes, because suddenly you free up parts of the nervous system that just wasn't very happy. And my final thoughts would be, to me, in an ideal world, every single baby, regardless of how they were born, really and truly should have, even if it's just 2-3 sessions, because I know what it does. And like I said it before, I know what it does because I also work with adults. So I can totally see the connection between how much of that stuff that we end up carrying unknowingly for the rest of our life with us. So to me, really and truly, any parents, it's just a magical gift that you can give to your newborn to help them just clean that slate and allow their nervous system to just go into a much happier and healthier direction after a few sessions, because it really doesn't take that long.
Awesome. And I do want to add for clarity on this in terms of accessibility and understanding that you've shared with me that a session, they're basically paying for a session in which we can use that time for both or the family.
Correct. So the way
right?
I work, exactly.
It's not like it's double or triple the cost.
Correct. Yes. Thank you for highlighting that. That's another question I get asked. Do I have to book 2 sessions and then therefore the cost is double? I offer a longer session so I can treat both the mom and the baby within the same session.
Love that. Yes. That's great. Well, I agree with you. I wish it was accessible for everyone to be able to get CST. I hope that down the road, insurance companies will cover it and more readily so that it can be a little more accessible to more people.
You know, the way I look at it, again, based on the fact that I know what it does later on in life, even if I just use my own example, all that time, all that money, and all that waste of everything going around in circle and driving yourself nuts. I would much rather pay a few $100 for a baby than to potentially pay thousands and thousands as an adult later on trying to fix things that you don't even know where the heck it's coming from.
Absolutely.
So to me, it's completely inexpensive for that very reason.
When you frame it that way. Yeah. It's another related thing is like investing in nutritious, nutrient-dense foods is an investment in your health, and you're preventing way more money and heartache and headache and hassle down the road in that way.
One of my mentors has this fantastic quote. Let me see if I get it right. You can either choose to pay the farmer or you can choose to pay your doctor later on. And I'm like, I agree. And I'm a foodie, so I enjoy nice tasting food. And I know the difference between a commercially farmed something, whether that's fruit or vegetables or meat, or an organic farm-raised thing. And I'm always willing to pay more for that because at 42, I'm not on any prescription drugs, and I don't have any aches and pains, no problem whatsoever. So I much rather keep it that way.
Agreed. Yeah. Thank you so much, Regina. This has been wonderful. I really hope it's been helpful to listeners to learn, especially if you weren't familiar with craniosacral therapy, about the many benefits and that it should be standard of care. So, Regina, tell us how people can get in touch with you if they'd like to reach out.
Sure. Easiest way will be coming onto my website. There's a form that you can fill out to get in touch with me. It's super simple. And the website is called BabyCranioNY.com.
And I will be sure to link that in the show notes, as well as to your Instagram. She has lots of great educational videos, reels on there that you can check out too. Well, thank you so much. This has been wonderful again to connect and to continue my education on this topic as well. Hope you have a great one.
Thank you. You too.
As we close things out today, I would love to hear from you on any questions you have about craniosacral therapy, or if you're on board and you're like, I want to schedule an appointment with Regina or another craniosacral therapist. I'd love to hear that too. Or also, I'm here for your skepticism. If you're kind of like, I don't know. I'd love to hear from you. So just send me an email at podcast@birthmattersnyc.com, or you can DM us over on Instagram at birthmattersnyc. Also, feel free to send us your ideas of other topics you'd like to hear about, or specific professionals you think would be great to have on the show to provide some educational content. I do also want to just point out that there's no one size fits all in most things in life, and there are a number of modalities that can treat and support you and your baby in different ways. Craniosacral therapy is a lesser known one of a number of excellent options. Before I share a sneak peek of what's up in the next birth story, I just wanted to remind you that if you're looking for birth classes, any kind of doula, whether for labor, postpartum, or even a fertility doula for your TTC journey, we'd be so honored to help with that. Just visit us at birthmattersnyc.com. In the next episode's birth story, another kind of bodywork will be highlighted, and that's chiropractic care. Here's a clip.
I think the moment you're pregnant, you feel totally 100% responsible for this tiny human that's growing inside of you. And a lot of times complications happen and it is out of your control. It is not something that you could have done differently. I think for me, I easily spiral into, oh, it's my posture. Maybe I should have worked differently. Maybe I should be watching what I do, how I walk, how I sit, how I eat. Maybe it's my fault that he's transverse. So I think talking to your baby, really that important aspect of letting go of it being your fault or your responsibility, it helps tremendously, because then you start to see this baby as, okay, they are about fully cooked at this point and they have their own mind and they're going to do what they want to do. So you just need to let it go.
If you enjoyed today's episode, I hope that you'll be sure that you are subscribed so that you don't miss out on any of the episodes that we release. And as always, thank you so much for listening to the Birth Matters podcast. We were so glad to have you with us today, and stay tuned for more. Be well.